Hi, I'm with the American Red Cross Communications team, and we get lots of questions from the public about blood donation and how blood is used to treat different kinds of patients. Now, I'm not a medical expert, but I get to work with people who are, and I'm sitting down with some of our medical experts to get answers to your most common questions. Today, we're talking about maternal health. Now, for women who experience complications during childbirth, having blood available has improved outcomes for countless individuals. And by being a blood donor, you can make a positive impact on maternal health too. Joining me is Dr. Lisa Wong, Regional Medical Director here at the American Red Cross. Thank you so much for joining us today, Dr. Wong.
Thanks for having me.
Can you tell us a little bit about yourself?
Sure. So my name is Dr. Lisa Wong. I'm a medical director with the American Red Cross, and I cover the state of California. Maternal health and public health in general was an interest of mine that started when I got my master's in public health at the University of California, Berkeley. I then went on to do my medical training at Emory University in Georgia, and then did a residency and fellowship in blood banking and transfusion medicine at Stanford University.
And the topic of maternal health is particularly of interest to you.
Yeah, it is a topic that is very near and dear to my heart. I myself experienced delivery-related complications a couple years ago when I gave birth and was hospitalized for a week afterwards.
Wow, okay. And I think you had mentioned before, as we were talking previously, about birth complications even run in your family.
Right. And so unfortunately, my sister also experienced a similar event where she also hemorrhaged. And she actually required multiple transfusions. And I do think that those transfusions saved her life.
Wow. Well, so that brings me to my first question. It seems like throughout history, it was not uncommon for women to die in childbirth. Today, that doesn't seem to happen as often. However, birth complications are pretty common, especially severe bleeding, postpartum hemorrhage. Let's talk about that. Why is postpartum hemorrhage from giving birth so common, and is there anything that we can do to prevent it?
Sure, that's a great question. So let's start first with postpartum hemorrhage. What does that mean? So broadly, that means any significant blood loss after childbirth. And it affects 1 to 5% of all deliveries. And if you think about it, that's not an insignificant number, given how many births happen in this country.
Yeah.
Thankfully, we do know a lot more about it now. We know a lot more about the risk factors, things like trauma, retained tissue, even pre-existing conditions like blood clotting conditions that some women might have can contribute to postpartum hemorrhage. And pregnancies in general, I think, are more medically complex. A lot more people have hypertension now, diabetes, obesity, and these all, sort of globally increase your risk of pregnancy and delivery-related complications. I think it's important to note that there is a component of racial disparity in this. Black women are 3 times more likely to die from pregnancy-related complications as women of other racial or ethnic groups. The good news is because we do know more in modern medicine, there are more things that we can do to try and prevent, manage, and monitor. And part of that is getting early access, screening access to care, monitoring, and managing those pre-existing conditions I mentioned. And then the last one is rapid treatment. And of that might include transfusion. And so I think that sort of underscores how important it is to have blood available because it's the blood that's on the shelf then and there, readily available, ready to transfuse, that ultimately does save a person's life.
Well, a lot of interesting factors there that I think people probably don't really think about. Now, when these types of conditions occur, doctors are often ordering blood transfusions. Can you talk about how and why blood is so important in the treatment for a postpartum hemorrhage?
Yeah, so postpartum hemorrhage is the leading cause of maternal death in the United States. I think some of the statistics that are cited is it's something like 11 to 14% of those deaths are attributable to postpartum hemorrhage. And unfortunately, these rates are higher in underrepresented communities. The key thing to think about, though, in this country is that hemorrhage, so bleeding-related deaths, maternal deaths, are considered preventable in this country. And that's because we have ability to have earlier detection and also rapid treatment, and that treatment includes blood transfusions. So access to blood is critical. It's critical in reducing maternal mortality in these events because if a person loses too much of their blood volume, the only option often is to massively transfuse blood.
I find that so interesting because I think when you think about the need for blood, so many people just think about trauma patients, accidents, and you don't think about women giving birth, and it happens every single day.
Absolutely.
That women are giving birth, and postpartum hemorrhage is pretty common. So when looking at the blood that is needed to support these types of patients, we know that there are 8 major blood types. Does blood type really matter in this type of situation? Are there particular blood types that are needed most for postpartum hemorrhage?
So again, postpartum hemorrhage, it can be lethal if you are bleeding out enough and blood is not available. Thankfully, we do have blood available. For most women, what we want to do is to try and transfuse type-specific blood. So for example, if a woman was type A, then we would try and transfuse type A. Unfortunately, conditions like postpartum hemorrhage, they can occur as an emergency. So it happens at home and they come into the hospital and there's not enough time to determine what their blood type might be. And in those cases, we'll do an emergency transfusion. And in pregnant women, that tends to be O negative blood because that is a blood that we can sort of give to people of any major blood type. It could require dozens of units of blood to stabilize the patient. So having a ready supply of blood is critically important. On top of blood, there are other components to blood and things like platelets and plasma. Those are also important because they are key parts in the clotting process. And so I think it underscores the importance of needing all blood types and all types of blood products are needed readily available to help patients like these.
And unfortunately, not all patients survive postpartum hemorrhage, right? So there are mortality rates, and we see that mortality rates can vary by community. So in some communities, the rates might be higher, even when factors like income and education might be similar. Can you talk about why would mortality rates be higher in some communities than others?
Yeah, this topic touches on the broader issue of health disparity, which is something I care deeply about. Some of the things that I can kind of think of off the top of my head are, especially since COVID-19, a lot of hospitals in rural communities have shut down or limited their labor and delivery wings. And so that necessitates patients having to travel sometimes hundreds of miles to go find care. And again, because postpartum hemorrhage is sometimes an emergency event, you can see how that would lead to a more negative outcome if they have to travel hundreds of miles to find care. The other example that I can think of is Latino and other minority communities, not just with maternal health, but globally they do experience barriers to healthcare, and that can include things like language access and gaps in health insurance coverage, and those things can lead to delays in seeking and receiving care, and all of this can increase their risk of complications. Included in that, of course, is in postpartum hemorrhage, you do want to be able to provide blood, and hopefully none of those things end up being a barrier, but maintaining a reliable blood supply is essential in ensuring moms of all communities have access to this life-saving care. And I do want to make a point that particularly the Latino community can make a significant contribution to the blood supply, and that's because 60% of the Latino community is type O blood, and that is the blood that we use in emergency transfusions where we don't know the person's blood type.
Well, that's a really great reminder that we need all types. It's important for everybody of all backgrounds to donate blood. For some patients with certain types of medical conditions, it can be important for us to know the ethnic background of both the donor and the patient. Can you talk about why it's important for individuals who are Black to donate blood, and then what that could mean for maternal health?
Yeah, that's a great question. So severe bleeding after childbirth affects 1 in 20 women and globally accounts for more than a quarter of maternal deaths. Unfortunately, these rates are worse in some ethnic backgrounds, and I think the one that comes readily to mind is sickle cell disease and sickle cell trait. So these conditions are more prevalent in Black women, and research has linked sickle cell disease to higher rates of severe maternal morbidity, and that has included infection, hemorrhage, and even stillbirth. And the reason why that happens is because sickle cell disease is a condition where a lot of people are transfused earlier in life. And besides the major ABO antigens, there are these minor antigens. And because the body sees so much of this foreign blood, they can even mount an immune response to these minor antigens. And why it's important for a diverse blood supply is that patients are more likely to respond well from donors with similar genetic backgrounds. And so the American Red Cross, for this reason, is very committed to increasing donor diversity. We do strongly think that it increases patient care for all. We care greatly about health equity, and including that is improving pregnancy outcomes.
That's a great way to explain why it's important for people of all ethnic backgrounds to donate blood. So we talked a little bit earlier about how blood is used for postpartum hemorrhage. Can you talk a bit about the importance of blood in maternal health care in general, and how can people help?
These conditions, they don't have to be a death sentence for new moms. Modern medicine has really improved survival rates for women experiencing all types of birth complications, including postpartum hemorrhage. But particularly in postpartum hemorrhage, because you are losing this key component of blood, often the only answer to that is to resupply blood from a different source, and so blood transfusions. And so blood is an essential part of treatment. It's blood that is already on the shelves, readily available then and there, that helps saves a life in an emergency. And so I do want to implore people to not wait until there's an emergency to donate blood. By donating blood regularly, we kind of help ensure that there is a steady supply of blood when people need it, because it does take time for a blood donation to then reach the shelf of a hospital. And that time is often too late if you were really treating it case by case. And it really does make an impression on me that when we give blood transfusion and it saves a patient's life in the hospital, it's because a donor came in days before, gave their blood, not knowing what condition that it was going to treat or what patient it was going to treat, but still generously donating their time and effort. And that really makes an impression on me, how much it matters to do it before something happens. And I think being a blood donor does, in this way, allow you to actively participate in modern medicine and impact patient outcomes. You can do it with just like an hour of your time. It's not too uncomfortable. I've done it. And I think that the fact that you can save someone is pretty amazing.
And a great reminder that we should not wait for an emergency to donate blood. It's the blood that's already on the shelves that helps save lives in that emergency. Thank you so much for joining us, Dr. Wong. Now, as we close, I want to remind you that giving blood is quick, it's easy, it's relatively painless, and I can say that as a blood donor myself. You may never meet the person who receives your blood, but it's pretty cool to think that your donation could potentially go to a new mother who hemorrhaged and help her go home to raise her newborn. That's pretty cool. We encourage you to learn more about blood donation by visiting redcrossblood.org.